Today we will discuss about sinus and fistula. Sinus is a blind tract leading from the surface to the tissues. There may be cavities in the tissues which is concerned to the surface through a sinus. Sinus is linked by a granulation tissue which may be epithelialized. And now what is fistula? Fistula is a connecting tract between two epithelial surfaces, commonly between a hollow viscus and the skin. Another one between two hollow viscera. The tract is lined by granulation tissue which is subsequently epithelialized. In sinus we have studied the same line, the sinus is lined by granulation tissue, but here we have studied that the tract is lined by granulation tissue. That's the difference between the sinuses and fistula. A fistula may be abnormal communication between vessels, like during dialysis we can artificially maintain arteriovenous fistula. Congenital sinuses are also mentioned. Congenital sinus, which are present from birth, are branchial fistula, tracheoesophageal fistula. Tracheoesophageal fistula can lead to pneumonia because the food will enter in your windpipe, leads to pneumonia. Arteriovenous fistula and preauricular sinuses. Acquired sinuses and fistula usually follow inadequate drainage of abscess. The perianal abscess may burst onto the surface and lead to formation of fistula in ano. Number 2. Acquired arteriovenous fistula is caused by the trauma or operation. Thyroglossal fistula and pilonidal sinus are the example of acquired variety. Causes of persistence of sinus. Why sinus persists for a long time? Due to presence of foreign body or necrotic tissue. Number 2. Absence of res. Non-dependent drainage or inadequate drainage of abscess is a cause of persistence of sinus. Number 3. Non-dependent drainage or inadequate drainage. Number 4. When a significant chronic infection is there, example tuberculosis, actinomycosis, etc. When the tract become epithelialized, sometimes there may be dense fiber around the wall of the tract and the cavity preventing their collapse. Presence of malignant disease are the cause of persistence of sinuses. And what are the cause of persistence of fistula? Once a true fistula has been formed, it seldom shows any intention towards healing. Moreover, irritant discharge such as urine, feces, bile, etc. are part of the fistula and prevents its healing. Obstruction of the lumen of the viscus and the tube distal to fistula is often the main cause of fistula. One thing should be remembered that if the natural passage is made patent, all abnormal offshoots heal spontaneously.